Good afternoon and welcome to today's SAMHSA-sponsored webinar titled Next Steps in Peer Support Credentialing. What else is needed now that we have guidance on national model standards from SAMHSA? Presented on behalf of the National Alliance on Mental Illness, also known as NAMI. Today's presentation will be recorded, and the recording link, slides, and a certificate of attendance will be sent via email to everyone who attended today. Closed captioning is available and can be viewed by clicking the CC icon at the bottom of your screen or clicking the link in the chat pod to view in a separate window. We also have an ASL interpreter who should be seen spotlit on your screen. During the presentation, please add your questions and comments into the chat box, and the questions will be asked out loud for the presenters to answer at the end of the presentation. When the presentation ends, please take a few moments to complete a brief survey that will show in your browser as you exit the platform. Thank you again for joining us, and we will now begin today's presentation.
Welcome, everybody. Excited to be here. We're going to be learning about a few things today. So first, we're going to hear about the background, development process, and dissemination of the National Model Standards as guidance for states, territories, and tribes for peer support certification. We're going to learn about the significance of peer support credentialing in terms of providing effective support services to those with serious mental illness and/or serious emotional disturbance and supporting the behavioral health workforce. We're going to discuss findings from NAMI's peer support survey, which was sent to both NAMI affiliate leaders and staff, as well as to peer support organizations that were not part of the NAMI affiliate network. Participants were asked to share their feedback on each of the standards, asked for suggestions for improvement, and shared other ideas related to implementing and supporting the standards. But most importantly, and most substantively today, we're going to have an opportunity for a discussion. We're going to provide our thoughts as an audience about what NAMI National's role could be in the peer support space and have broader conversations about the peer support credentialing process. Next slide, please, Bailey. So maybe asking yourself, who am I going to be hearing from? My name is Leah Wentworth. I'm the National Director of Research and Evaluation at NAMI National, and I'm also going to be serving as moderator today in place of Dr. Brister, who was our Chief Program Officer at NAMI. I'd like to give Amy a chance to introduce herself.
Hi, everybody. Amy Brinkley. I'm the Senior Recovery Support Systems Coordinator at NASMHPD, and I also hold a dual role as a NAMI National Board Member.
And Jen?
Hello, everyone. You can see I am Jennifer Snow. I am not Hannah Wesolowski, as you'll see on the screen. Hannah is my boss. I am the National Director of Government Relations and Policy at NAMI National, which means I lead the team that's working with the federal government, both at the executive and congressional branches, to advance policies that advance NAMI's mission, which is to build better lives for people with mental health conditions and their families. Thanks, Leah.
So we certainly have some different folks, but we're all just as excited to be here, excited about this content, and excited for the conversation especially. Next slide, please. So the peer model standards, I want to start by talking about the why for how we got into asking surveys for both our affiliates and for folks that are in the peer support space but are not part of NAMI. NAMI has raised the voice of peer support and peer leadership as part of our work. We have a peer leadership council that advises the board of directors about consumer members and peer needs. The role of that group is to advance advocacy, to advance activities and involvement in consumer membership, to empower, to educate, and to bring the voice of lived experience to the leadership of the NAMI. Next slide, please. In 2023, as part of the background around the model standards being developed and being implemented, the board of directors created a peer support specialist credentialing work group to really dive into this. And then initially they developed a survey for feedback that only had 22 responses. Now that was a shorter administration period. It was really focused in terms of who it was sent to. And in reviewing the results from that survey, that work group decided they wanted a broader reach. They wanted to get more perspectives across the alliance within NAMI, but also to hear from folks that have expertise in the peer support space that weren't directly connected to NAMI. They wanted to understand perspectives around credentialing specifically. They wanted to understand what fields of peer support people were working in, and they wanted to understand perspectives both from within the NAMI alliance and outside of it, what NAMI's role could be in peer support. So the group committed to a second survey administration with intentional recruitment in both the NAMI catchment and outside of it to get as broad a perspective as possible, to really understand a range of experiences and perspectives, and to really inform the work that NAMI can be doing to best support peer support moving forward. Next slide, please. Amy, I'll turn it over to you.
Thank you, Leah. So good afternoon, everybody. It's nice to see so many friends and familiar names that I recognize. I see several of our NASHPD Recovery Sports Division members too. So before I jump into the basic information on the survey, I just want to state again that I have a dual role here today. So I also serve as NAMI National Board Member. And as Leah shared, I'm the co-chair of the Peer Credentialing Work Group. So as a little bit of background, many of you will remember and you know that the Biden Unity Agenda in 2022 had put out a call for a national peer certification, which kind of started these conversations on the national level. And then what we saw over the next year is SAMHSA put out their national model standards for peer support certification program. So we've all been having all of these different conversations, but in the NAMI space, there was a lot of initial conversation about where does NAMI fit within this space. And so the conversations were evolving, and some of the conversations were around whether NAMI should have a peer, not a peer credential or not a NAMI peer certification, but rather should NAMI have some sort of a NAMI standards of excellence in a way, like a NAMI stamp of approval on certification programs that met the NAMI standard. And so those kinds of conversations evolved into, well, we don't have enough people in this room to make that decision. So we wanted to send out a survey to get more feedback from the NAMI space. So we sent the NAMI survey just to the PLC, the Peer Leadership Council members, and to a few of the NAMI national folks that we had involved. And like Leah said, we didn't get enough feedback from that survey. So this is when we said, okay, we need to have this be a better survey so that we could hear from the general field what they feel and how they feel, what NAMI's role is within the peer support space. So that's what this survey is about. And so I'll go ahead and jump in. So there were a total of 162 participants who responded to the survey. The survey was open for a little bit more than 3 weeks. We started April 11th and ended May 3rd. And the survey was sent to a selection of NAMI's staff directors and program directors, as well as the Peer Leadership Council. And we just shared it broadly. Altogether, we had 35 states and territories who responded, and we had about 18 states that did not. So I'm going to go through the demographics quickly, and then we're going to dive into conversation on some of the meatier stuff towards the end of the present, or not the end of the presentation, but towards the end of the demographics. Next slide, please. So when folks were asked about their race and ethnicity, what we found is that 73% were white, about 13% identified as Black and African American, 5% Hispanic and Latino, 5% Asian, and then no American Indian Alaska Native. I think we did have a number there. I think maybe that might be a typo. And then we had 4% prefer not to respond. And then as far as gender responses, women were 72%, men were 21%. And I just want to note that, when you glance at this, the thing that jumps out to me is that we had 72% of white women responding to the survey. So I just want to note that's notable. So when we asked folks, are you certified to provide peer support services? 54% said yes, 44% said no. When we asked if they were currently in the process of working towards their certified peer specialist certificate, 76% said no and 24% said yes. Next slide. Next slide. Sorry, I'm going too fast. So when we asked folks, are you currently working as a certified peer specialist? We had the 48% that said yes, 52% said no. When we asked folks what type of peer support they were providing, what you see on the slide is family peer support was at 19%, forensic peer support was at 7%, and the highest responses came from folks providing mental health peer support at 77%, and then 55% were providing peer support as substance use, and 7% veteran peer support, 8% youth and young adult, and then we had a spattering of other types of peer support. So next slide, please. So we also wanted to make sure that we knew what folks identified as their association to NAMI. And so what we found, which I thought was kind of interesting actually, is that 27% had no association to NAMI. So when we're thinking about some of the feedback that came in from the survey, I think that's important to note what other people not affiliated with NAMI think that NAMI's role should be, as well as what people who already are affiliated with NAMI think NAMI's role should be in this space. Equally notable is that paid staff and program leaders and facilitators of NAMI represented more than half of the respondents. And then members, participants, 26%, and about 21% identified as volunteers, 12% identified as board members. Next slide, please. So when we asked people through the survey what they thought NAMI's role in peer support credentialing should be, what we found is that 72% of the overall respondents to the survey indicated that NAMI should be providing advocacy and awareness around peer credentialing, and that NAMI should be providing support to peers, and that NAMI should be providing training and education. The review and endorsement of standards was just under half, which if you remember at the top of the call, like that was the overarching purpose of even, putting the survey out, was because we thought maybe NAMI should be doing some sort of an endorsement of standards. But what we found out through the survey is that less than half thought that we should be. Next slide, please. So what you see here is actually the 11 standards that were issued through the through SAMHSA's peer model standards. And so the standards focus in on authenticity and lived experience. So peers should, SAMHSA standard basically, in a nutshell, indicates that peers should be able to describe their own experience and be able to share their own story. And then on the diversity, equity, inclusion, and accessibility, the standard says that that peer certification programs should ensure access to prospective peers who may also have disabilities or other barriers, including strategies on increasing access. Related to ethics, state certifications should have peer ethics committees made up of peers to review and assess reported ethical violations. The fourth standard around examinations and content of examinations, the standard goes into a lot of details that we very briefly summarize here, that relates directly to and is appropriately based on the peer role, mental health, substance use, or family, and it should only reflect information explicitly covered in the trainings. And then there's a standard related to development and revision of exams that should be led by certified peer workers to promote fidelity and reliability. Relating to number 5, costs and fees, SAMHSA's model standards said that state certification entities should seek for pathways to subsidize and pay for all peer certification and recertification costs, and that the training and quantity of hours for training, the requirements should only range from 40 to 60 hours, for all mental health, substance use, and family peer certifications. And like we all know, the current national training hours are across the board, and some are in well over 100 hours. So the recommendation is definitely different from what we're seeing in the States. And then the content facilitation should incorporate the accommodations outlined in model standard number 8 related to DEI-A. And then the recommendation around supervised work experience is that the maximum number of supervised hours required for certification should be 120 hours. And for states that require supervision hours, all prospective peers should be able to access a list of eligible sites to get supervision hours. And then background checks, the recommendation is that there should be no background check at the certification level. No formal education is recommended at the certification level, and no length of abstinence or recovery time requirements are recommended at the certification level. Specific to peer supervision, which is the last one, state certification entities should require that prospective certified peer supervisors have direct experience as a peer worker. So what we put in the side box here is really the where all of the respondents landed. So what we see is that there's largely agreement from the field, from the NAMI related field through the survey in all of the standards. The lowest agreement that we saw was related specifically to recovery and then the formal education, followed by the background checks. So what we did at NAMICon at this section is we opened it up for dialogue. So we wanted to qualitatively hear from the field. Were you surprised by any of these responses? Are you surprised by the lack of agreement or the breadth of agreement? So I would actually put that in the, if you can, and Leah, I'm kind of leaning on you because this is where we went into dialogue. So if you guys can, if you guys have thoughts related to this, please put it in the chat because we would love to hear from you. Are you in
Definitely
agreement
going
on?
to facilitate. We're going to facilitate some great conversations here for sure. So we're so on the same page, Amy. I
Okay.
think we can continue a little bit further, but we'll come back to the slide as a chance to as a touch point for folks to look at the standards. We have also received one question already about why recovery was the lowest, but we'll get to that in just a little bit.
Perfect. So I think this is a good, oh no, we do need to go through one more. So go to one more slide and then we'll circle back and pivot. So the last two questions on the survey are question number 10, which was, are you aware of anything that NAMI is already doing in the local, state, or national space to support peers? And what we saw was a lot of open-ended responses on the various ways that NAMI is already supporting peers. And then the second question, question number 11, are you aware of anything that NAMI is already doing in the local, state, or national space related to certifying peer support credentialing? And we had a lot of open-ended responses. So I would actually ask the group here too, everybody who's listening and who's participating in this webinar to please put in the chat if you have anything to provide, any information to provide related to either of these questions as well. And then we will probably pivot back to this. But for now, Leah, I think I'll pass it back to your team to kind of take us through the rest of the slide deck, and then we'll come back here for some dialogue.
Sure. That sounds great. And I think we're pretty close to the dialogue-y points because I think there are some people are getting excited about some of the questions. So next slide, please. Yeah. So feel free to jump in here, Amy, too, because I think this has got some really good qualitative feedback. And I think we saw a lot of really interesting conversations around the work group and some opportunities for NAMI here. So I think one thing that has come across in terms of the survey feedback and things we heard a lot at NAMICon is looking at how NAMI is in part of the recruitment and support of folks that are interested in becoming certified peer specialists. We saw this, people saying, identifying great candidates to go through that training process, helping folks become part of the peer specialist process and helping find job placements. Those were some of the most common responses where NAMI was demonstrating excellence and doing great work. So I think too, the opportunities around training kept on coming up from folks in terms of other opportunities, other feedback that we kept hearing about, that NAMI is doing great work in the training space. Next slide. Okay, so Bailey at number 1, I appreciate you completely. Can we go back to that slide that had all the standards? I believe it is 2 slides back. One more. There we go. That's perfect. You're fantastic. That's perfect. So this feels like a place where we want to make sure to give both the content for folks to respond to and start to have a dialogue with people. And I've already received one question about recovery and why we think that recovery had the lowest agreement of any of these things. I'm going to share what I saw on the survey, and Amy, I'd love for you to weigh in here in terms of your expertise. People weren't entirely sure why recovery was the one that had the least agreement. And I saw two buckets of thought in the survey feedback. The first was folks didn't have agreement on harm reduction principles versus complete abstinence. So in terms of there are no abstinence standards, there's no length of abstinence, there's no standard around whether harm reduction is an appropriate baseline for folks. And so that I saw feedback all over this space in terms of where people felt they should be in their recovery journey to be effective in terms of their peer support work. So I was surprised at the not surprised. There was a lot of diversity of opinion, and there was a lot of passion about people's perspectives here. And so I understand how it's possible to have the lack of a standard here. There's no lack of an expectation doesn't imply a lack of engagement. People are certainly thinking really critically about that. So I want to pause here and give Amy some space if there's thoughts about recovery in terms of standard, no standard ideas, what you've seen and heard.
No, I would agree with that, Leah. And I just went back because I have this pulled up on my other slide. I went back to the types of peer support providers that responded, and 77% are providing mental health peer support, and about half are providing substance use peer support. So that being said, recovery being at the lowest end of agreement, while the majority of people that responded to the survey are in the mental health space. So there is going to be some disconnect in what's happening in the harm reduction space, number one. Number two, not having any recovery time as part of the certification process actually helps enhance the peer space, because who knows where that peer is going to go work. So a peer can end up working, like, let me just use Indiana as an example. In the state of Indiana, we have peer recovery community organizations that actually have state grants to be harm reduction street outreach team workers.
Right.
So if there was a recovery designation on that, then people who are maybe working in these spaces may not be able to get certified as a peer, which is a requirement to provide that service. So it really puts the onus back on the employer to define what they want as it relates to both the recovery as well as the education and the background checks. Those are really employer related issues. The employer needs to decide what they want those areas to look like for their staff. Does that make sense?
That's perfect, because in terms of describing standard versus great practices, and this is an important place for us to highlight what SAMHSA had given in terms of the guidelines are a floor, not a ceiling. The input from states and from other engaged folks is helpful, but that there is a certain amount of good practices that need to be happening at the employer standpoint. This is such a perfect example of saying we every situation, every setting may require some nuance. And so having standards in place does facilitate some baseline, but there may need to be some setting specific additional content. So thank you. That was perfect response to that. Awesome. I want to highlight too that Katie put in the chat, we had that missing information. That was 3.7% of respondents identify as American Indian or Alaska Native. And again, all of the slides will be provided.
Thank you for doing that. I just want to say one thing to Leah before we move on. So when we think about where peers work today, peers are working in all sorts of places. They're working in courts, they're working in the prisons, they're working in the jails, they're working in behavioral health clinics, they're working in certified community behavioral health clinics, they're working in all of these different spaces. So we should really have, like, all of these standards are specific. I just want to make this clarification. All of these standards are specific to the certification level. So in order for, so as an example, I am certified peer and I applied the certification to go through the training, take a test showing competencies, and then I get my certificate. Then I take that certificate and I go try to find a job. So these standards are specifically just specific to the certification. So I just want to, like, background checks, formal education, this should be the same as any other certification or license. Or do we do background checks? Do we do drug tests to become any kind of other specialized training or license? We usually don't. So why would we do it for peers? There needs to be the same standards for peer certifications as other areas, is my point. And I'm feeling a little tired, so I'm not using my words as well as I usually do. So I just want to be transparent about that as well.
I appreciate your authenticity. I think if I cannot imagine an audience, and I've not experienced an audience that gives us more space and grace than this audience in terms of this webinar series, it's just a very supportive place. And so I appreciate you being honest about how you're feeling. And I think this is a great place for us to ask for feedback from the audience. Do you have any responses to the standards? Have you received feedback from your colleagues? Do you have different practices in terms of the work that's happening in your field? Want to give time and space to this one in particular. Is there, yeah, I also, John, 100% agree with you. Amy is doing wonderfully because she is wonderful. Both of those things are true. You are wonderful. You are doing wonderful.
I'm not working at my top. I know that.
You're fabulous. I also, Amy, want to give you a chance if there's anything from, at NAMICon, Amy presented this information to part of our impact sessions, and there were some really rich conversations about innovation happening and then the state and the local level. And I want to make sure if there's anything that you were surprised by or that you were excited by from those conversations, recognizing that those folks may not be on the call, if there's anything that you want to respond to.
Nothing really stands out to me right now.
Great. We can always come back to that if you think of anything. I recognize sometimes conversation spawns memories, and those memories turn into sort of next step questions. So We are getting oodles of questions coming in here,
Yeah.
which is fantastic. Love a dialogue, love folks. Stephen asks, what's the relevant lived experience with 2 asterisks mean?
I'm looking for it.
So it's the bottom on 11.
You know, I don't know off the top of my head, but I think that might have just been how it was laid out in the SAMHSA peer certification model standards document. But I will say this, I'm going to find the link and put it in the chat because
Sure.
we truly summarize the actual version of each of these standards. So if you go to the model standards document, you're going to find so much content there that's not here.
Awesome. So this is a great question, and I think I know the answer to this, but I'm looking forward to Amy's great ideas on this. While there's a lot of training at the employer level, are there any trainings that we could be somewhat universally recommended? QPR, mental health first aid, NAMI programs, etc.
Well, I think, Leah, you could answer that.
I think, well, so I'm going to go back to pulling, I'm going to pull from Amy today. You know, certainly setting is going to be part of the context, right? So I think depending on the setting, on the population that we're seeking to serve, we have seen a lot of support for the NAMI programming that we do. So I think that those both things, I feel Wolf Ryan answered some of the question himself. And also, yes, there's some things that I think are pretty well regarded, if not universally recognized.
Yeah, and I would agree with that. And I would say every state's different too. So each state has their own way of handling their peer training. For example, Texas has a core training that all substance use, mental health, and family member peers go through. And then they have endorsement trainings that are also required anywhere from, I think, 30 to 40 hours. I could be a little bit off on that, so don't quote me on that. But the 30 or 40 hours is additional training beyond the initial core training that you have to have for that specific lived experience. As far as any kind of a national standardized training for peers, nothing that I can come up with. Every state does their own.
So we have a saying in the NAMI universe, if you've seen one NAMI, you've seen one NAMI. I think that's true in terms of the peer support standards and training requirements as well. Like that there's just so much diversity of expectation and requirements beyond the standards. So I think it's important to be aware of where things are being implemented and looking for the specifics. Awesome.
Yeah, last thing I'll say on that, and I'm going to look for the chat and or I'm looking for the link and put it in the chat, is that NASMHPD Research Institute did a peer workforce report, I guess you could say, last year. And in the report, I think there was like 30 states that identified they were working on a crisis peer curriculum. So whether that ended up being part of the existing peer certification or whether that ended up being an endorsement training looks different in every state. But I'll try to find that link and I'll stick it in the chat.
And I'm very grateful for you wearing both of your hats today right now, Amy, because I realize that you're kind of pivoting between NASMHPD and NAMI in terms of your expertise and roles. So deeply appreciate you. Hawaii is lacking peer specialist training certification and renewal. What's available for assistance?
Wait, say that one more time.
Hawaii is lacking peer specialist training, certification, and renewal. We need help. What's available?
So here's what I will say. My colleague at NASMHPD, Justin Volpe, he has been involved with Hawaii with some technical assistance for the last couple of years. I'm kind of wishing he was on this call so he could respond. I know that Hawaii's state has been looking at a peer certification, and last I heard, I thought they were contracting with somebody to develop that. So I'll tell you what I'll do for that one. I'll put my email in the chat. And just send me a direct email and I can try to address that offline.
Awesome. So I think this is a really interesting comment that's worth reading. I think it's important to look at recovery objectively, referring to SAMHSA working definition of recovery, taking what worked for you out of it and acknowledge that your path may not be the person's path you're working with will lead to positive outcomes. That's a really interesting perspective and an important one to think about. We did include in the chat the model standards. So, and again, the slides, all of the content will be shared again. So this is a huge question, Amy, and I realize it may be too big to answer on this call, and so I just caveats. I'm very interested in learning more about how states are implementing the model standards, what tools are being used to measure their successful implementation, besides states just saying that they're in alignment without a third-party review or tool.
I'll say I don't know that any state is saying that they're in line with the SAMHSA standards without a tool. I will say that TAC has been working with states and encouraging them to look per SAMHSA. TAC has been working with states and urging them to look at their standards as it relates to the model standards. And I know that through I believe it was a NASHPD TTI grant. Wendy Tygreen has a tool that states are using now to look at how their standards measure up to SAMHSA standards as well. But that's independent to the state. States could have their own tools, and then there are a couple national tools floating around that states are using. And I can share that SAMHSA's Spark, which is SAMHSA's Programs to Advance Recovery Knowledge. It's a national TA center. They've been working with states. We've had a couple requests come in through there from states asking for a tool so they can look at that. So each state is independent, and each state, I would say what I'm seeing anecdotally, not anything that I've looked at, in a research project or anything. Anecdotally, the majority of states are looking at their standards and as it relates to that SAMHSA model standard. But would I say all of them are? No. Would I say that all states are working towards that? No.
Okay.
But I would say the majority.
I think of anybody on this call or other people I know, I would trust your sort of baseline understanding of the state. So I think that's good to know in terms of how people are describing what they're doing and what they're doing with it. Let's see here. I want to make sure to give space to the advocacy conversation, and I'm wondering if that may be a good place for us to pivot.
Let's do it, because we can always come back and talk to NAMI's role on the other slide too at the end.
Love it. Bailey, could you do a favor and launch the poll, please, as we're thinking about advocacy and NAMI's role? So to all of our participants, we're going to do this poll as a starting point and give Jen Snow some space to talk about our advocacy, how NAMI is helping to support advocacy around peer support. Take a minute. Love to hear your responses. Give people a little space. And we'll give people another, let's say, 10 seconds to respond. Going once. Going twice. And we'll call it. Thank you very much, Bailey. So in terms of looking at this, I'm going to give Jen the chance to talk about this. It is interesting to see folks, recruitment to the peer support field, reimbursement rate for peers, coverage, supervision. Interesting that, and I realize this is a single choice poll, so it may be that everybody would have selected all of these responses. And I think I could find value in all of these responses. And so appreciate people's prioritization. Awesome. I want to turn it over to Jen. Give her a chance to talk about our advocacy work.
Great. Thank you so much, Leah. And thanks, folks, for filling out this survey. As I said at the onset, I have the privilege of working at NAMI National and working to advance our mission, which is, from my vantage point, is related to public policies that improve the lives of people with mental health conditions and their families. That is a big, audacious, wonderful mission, but it means that NAMI advocates in a lot of different areas, whether it's mental health services and supports, housing, supported employment, research. You know, our mission is huge and we do a lot of things. So I really appreciate seeing the results here, and very much so that there's not one option here that is above and beyond the rest by a significant margin. Certainly, it looks like reimbursement rates for peers got the most votes with 16. And certainly that is something that we consistently hear from folks that is both a deterrent to recruiting people to the peer support field, which is, I think, number 2 on this list. And really a detriment to people, you know, staying within the field, because if you're not able to have be reimbursed appropriately for the services that you provide, it's really hard to be able to stay in that field. So if we could move to slide 44 or 46, really, that would be great. So folks have a visual. We wanted to and I'll give a moment as that's coming up on the screen now. We wanted to make sure that give folks a sense of kind of the coverage landscape with this wonderful map here. As I'm sure many of you on the phone know, Medicaid is the single largest payer of mental health and substance use disorder services in this country. Therefore, Medicaid has an outsized impact on our people, our issues. So we wanted to talk about Medicaid in the context of the coverage of peer support services. It is important to remember, and I'm sure most of you on the phone call know this, but want to make sure that we set the framework appropriately for those who might not be as familiar, that Medicaid is a joint federal-state program, which means that states are in charge of setting the rules of the road for their Medicaid programs within really large federal guidelines. And as a result, you can see this map with a lot of different colors. Thankfully, and the source of this map is the Peer Recovery Center of Excellence, which was a grant from SAMHSA. I believe Amy mentioned that earlier. You can see that the vast majority of states, 48 states, provide reimbursement under Medicaid for one-on-one peer support services. The pink states, although truthfully, I'm questioning the color choices of the technical or the Center of Excellence. The states that are kind of a light pink purple, they provide coverage for just mental health peer support services. And the green states provide coverage for just substance use services. So there is a huge swath of coverage of peer support services, but the payment rates for those services vary significantly across states. States are allowed to set their own payment rates for all Medicaid covered services, which is why we have a huge variety in what reimbursement rates are available across the country, and you know, how that impacts the entire industry or the entire field. So we're not going to go to the next slide and talk a little bit about Medicare coverage. As we said, while Medicaid is the backbone of coverage of mental health services in this country, Medicare is a significant payer for millions of people with mental health conditions who have Medicare coverage, usually as either a result of their mental health condition being to the point of a disabling mental health condition, or if they are over age 65. There have been some recent policy changes in Medicare that have provided more flexibility into the type of services that are provided and the type of providers that can bill Medicare. And specifically, peer support specialists recently are able now to be part of care teams and have their work covered by Medicare. The new payment really is the new payment codes available starting in 2024 for Medicare beneficiaries would pay almost $80 an hour. Then that is adjusted based on the region and the site of service. So just wanted to give you a sense that an estimate that you can see on this slide from the Commonwealth Fund is that over the course of a year, if you assume that a peer support specialist saw approximately 6 people a day for an hour-long appointments, they could bill more than $100,000 under the Medicare program. We really view this as a critical potential financing stream for services, and also an acknowledgement of the contribution of peer support specialists for individuals on Medicare. We have done a lot of advocacy, and we're really grateful to see these changes within Medicare. Forgive me that I neglected to mention, thinking back to Medicaid, which is the state federal program, just this past June, the federal agency that administers Medicaid issued some frequently asked questions that clarified coverage of peer support workers. This is really the first time that the agency has done so since about 2007, so it's pretty significant. I want to read, though, what I view as the most critical piece that we were so glad that the agency did include in this frequently asked question. And I'm just going to read that directly to you. That CMS strongly encourages states to expand availability and utilization of peer support services to serve adults, youth, and families who experience mental health conditions and/or substance use disorders, by allowing coverage of peer support services in emergency rooms and inpatient settings. Furthermore, CMS encourages states to ensure that payment rates for peer support services are sufficient to support a living wage for peer support providers who are critical members of the care team for individuals with mental health conditions and/or substance use disorders. Before I came to NAMI, I spent many years working in the federal government, and I realized that these words might sound good and you know, you might, but yet you might view and not think, well, this is not a requirement for states to you know, provide coverage or provide a living wage. But the fact that CMS has put this in writing, encouraging states to do this, provides us an enormous advocacy opportunity in terms of working with individual state policymakers to improve coverage opportunities and improve reimbursement rates. So we were really delighted to see this when it came out last month, and we're so glad that it reflected some of what we had been asking the agency to do for a long while. So that really is the overview of some of our advocacy work and some of the recent state of coverage, particularly when it comes to public programs. I'm happy to answer any questions. I have not looked in the chat, but I see that it looks like it's fast and furious. Things are coming in. Leah, I don't know if you have been looking to MC or if there are specific questions to answer.
So the briefer and probably easier to answer, is there a way to get copy and information on those codes? I assume that's the reimbursement codes that you were referencing.
Sure. Yes, happy to. Let me think of what the best way, if I have I can drop the resources in the chat. That might be the best way. I will do that next.
And if I'm going to volunteer, if you want to share anything, either in sort of reflecting about areas where you want to highlight additional information, if you want to share any of those resources with me, I can work as we're disseminating the slides and other things to get those out to folks as well.
Thank you, Leah. And I would also say, folks on the phone, I know I've seen a lot of familiar names and faces there, but feel free. I'm at jsnow@nami.org. You can shoot me an email if you want to have you know, separate conversation or ask any additional questions. Just always throwing that out there.
So this is a detailed and fairly nuanced question. I want to make sure, Jen, jump in if you have follow-up questions or anything else, but one of the biggest drawbacks, and near fatally so, of Medicaid reimbursement that requires peer support workers to participate in clinical note-taking for billing purposes. That means that peer supporters need to use diagnostic language in most instances. Is there an opportunity for NAMI to use a national position as an advocacy organization to look at this practice? You're muted, Jen. Sorry.
Guys, I know that we're 3-4 years into the pandemic, but it wouldn't be a Zoom call if somebody didn't need to be told to come off of mute. So this is certainly an issue that I have heard before, but not one that I fully know if there is a role for the federal government to be able to dictate related to the specific requirements of the care team. That is often done at the state level, but it is certainly an issue that we as NAMI are aware of. And, I would love to learn more and to spend more time to figure out the right way for us to raise those voices in context with the policymakers and really figuring out, is it CMS that has the ability to make that change, or is this something that we need to be advocating for individually with the state policymakers?
Awesome. I appreciate your thoughtfulness on this and recognize that it's a nuanced and complicated issue. So questions for Jen in the advocacy space. And in the meantime, we can go, there's a few questions from the previous section that I can go ahead and ask while we're kind of noodling a little bit too. So let's see. To clarify, or got a question asking us to clarify recovery versus resiliency. Why does recovery apply only to substance use mental health peer certifications? And I'm looking to Amy for this one to start.
So it doesn't only apply to substance use. So that's my first thought. So there's been I feel like there's been a pivot, and some of you may feel differently depending upon where you're at and what you're hearing and what circles that you're like in this space around. But well, let me just keep it personal. So when I worked for the state of Indiana, I oversaw peer recovery sports services in our state for about 5 years. And what I found is that there was this myth that recovery only pertains to substance use. And I always fought to eliminate that. And we started putting out a lot of language and resources and tools around calling out mental health recovery and substance use recovery. And so, but there's still some people who just don't resonate. They don't align. They don't feel any connection to the term recovery. And so sometimes even just making that a blanket statement isn't fair either, because we hear from young people that they resonate more with resilience, and people on the mental health side typically resonate more with wellness. And so I think just trying to get to a place where we use the terms together, wellness, recovery, and resilience, I think is always a positive. It's a win-win when we can do that, because no matter how we try to, lump everything into one word or encompass everything under one header, sometimes we're not gonna hit everybody.
That's a really important point. I think that the difference is, and I come from the college health space, and so resiliency is very much the language that I see folks using. So I appreciate your awareness of different audiences resonating with different language, and the fact that we're often saying some of the same things. And so just being precise as we're communicating with each other. And Kimberly, I appreciate your perspective in terms of resilience or wellness. So Bailey, I would appreciate, if at all possible, if we could go back to slide 14. That is those questions about people's perspectives on NAMI's role, because I want to make sure we have time to talk about that. But we also have some questions that I thought would be interesting in advance of getting into that. So one question that came up in terms of kind of broader, do you see how the model standards affecting the quality and the availability of peer support? What's your take on that, Amy, in terms of how the standards are driving quality and availability?
I was multitasking, looking for a resource. Say that one more time while I pop this link in the chat.
Absolutely. And I appreciate the fact that I've seen you're in the chat, you're peppering with resources and perspectives, and deeply appreciate your expertise, your knowledge, and your availability to do several things at once. In terms of the model standards, how has the introduction, or how will the introduction of the model standards and the baseline for folks influence quality and availability of peer support?
So, well, and I think this will resonate with a lot of the folks that are listening in. I think the goal of this, if I can be direct, when SAMHSA put out the model standards, it was in response to the Biden Unity Address calling for a national peer certification. historically speaking, there's not been a successful national peer certification. And so the pivot was then to create these low barrier model standards, in my opinion, to endorse and push states towards reciprocity. And so what we're starting to see now is states are looking and reviewing their model standards as it compares to SAMHSA's. What we're starting to hear is that there's some regional work happening where certain SAMHSA regions are coming together and saying, hey, can we align at least our state's standards around this model standard, SAMHSA's peer model standards, and develop reciprocity so that when people move between states, their certification is just as valid to bill Medicaid in the neighboring state as it is in their own. And so I think that's the biggest thing that at least I'm seeing coming out of this. In terms of quality, I mean, I'm just going to be honest, if you're a state that has, for example, I'll use Illinois, if you're a state that has a very high bar for peers, it's a high bar, but it's also equivalent to a licensed clinical mental health professional in Illinois state to bill Medicaid. So it's very hard. It's very much a long process to get your certification in Illinois because it's equal to a licensure in Illinois. And I can't speak to all of the details of that, but my point is that if you're Illinois, these standards, these coming back to these standards would actually be lowering your peer certification standard. So that wouldn't build in quality, right, in terms of how they're looking at it and viewing it. So I think it's a state by state viewpoint. And I would say that if anything, what this is going to do is move us towards reciprocity and towards standardization of peer certification programs across the country.
That's great.
And if folks have other ideas, please put them in the chat.
Yeah, and I think you're highlighting an interesting point, which is something that I think we see in a range of settings, not just within the peer space. You know, folks that are doing great work, the standards are just to highlight the fact that they're meeting or exceeding the standards, right? Like that's often the case. For states that are trying to build to a capacity level, that sets a good baseline. And then the idea of reciprocity is really important. I think about how many colleagues I have that live 20 minutes from another state, and that it's really easy if they're working within their own state, but to be able to go across the state lines and have no barriers to being immediately employed and helping to serve the peer community makes good sense. So I love to hear that there's a regional kind of approach. We have a question about diversity. Are there any numbers on peer support workers that are diverse, and how diverse is the employment in NAMI? So I'm going to go ahead and say from the NAMI standpoint, I don't think we have across the Alliance the numbers of diverse employees across all of our affiliates. I'm looking at Jen in case she knows something that I don't. I don't think we have information on race, ethnicity, country of origin among our employees or volunteers. I can say that from other segments of the population that we're working with, so for example, within our support group facilitators, about 20% of our support group facilitators identify as race, ethnicity, country of origin other than white. Now that includes folks who identify with more than one race. So we do that survey about once a year, and that is a function of some work we're doing to expand our support groups in diverse communities. Now I realize that is not at all describing our overall NAMI approach, our overall NAMI demographics, but just wanted to give some information about what we understand the folks that are serving their communities. Jen, anything you want to add or any other information you have?
No, Leah, I'm similar to you. I am not aware of anything public, but we can go back to our HR department to see if there is something available that we could share, especially when it comes to the question about not individual NAMI staff and the diversity.
Great. And Amy, do you know anything in terms of the statistics on peer support workers and the diversity within that workforce?
Yeah, I'm jumping out of my seat ready to answer this one because I have a lot. So, not the one related to NAMI, but putting on my other hat, my NASMHPD hat. So there's nothing currently published that I've seen that that where you can go and find that information. But here's what I will say. I have a couple of things to say related to this. So when I worked in state government, it feels like a lifetime ago, but it was 2.5 years ago. I was there for 5 years, but when I started in 2017, we weren't collecting that information. And so as our state office and our country started moving towards talking about equity issues and diversity, and we started looking at it, and I realized we weren't even capturing that information. So like as a state, like as the state rep overseeing peer recovery support services, I had to make sure that we were actually asking those questions, all of the basic demographic questions during the application process, but then also as well as during the recertification process. So now bringing it to present day, what I will say is that I know some states are looking at quality improvement measures for their peer certification programs biannually. And so I know a lot of states are starting to, and actually I would say probably the majority, if not all, already capture that information, but it's not being reported up anywhere. So it usually stops at the certification level, or it may stop at the state level, whoever's the overseeing body of that peer certification program. That being said, last year, SAMHSA put out I think it was last year, SAMHSA put out a public comment for updating block grant recovery data requirements. And so what I'm anticipating, and of course I'm not SAMHSA, so we won't know until it's done, but I'm anticipating that SAMHSA is going to start asking for that kind of information through block grants, through block grant reporting requirements. And I actually, part of why I'm so tired and a little slow today is because I just came out of our NASMHPD annual conference in DC. And we met with we had a recovery support services division meeting where several state recovery leads were there. And then our NASMHPD Research Institute joined us, and she asked us, if we were to capture anything globally from the states related to peer support, kind of what would you want to capture? This was what we talked about. Just basic demographic information on peers, as well as information captured during the recertification process. Where are they working so that we can identify career pathways? How much are they making so we can identify wages? Because there's no national wage database either. So that information just largely isn't collected. We have all of these new Medicaid reimbursement reports coming out, and all of the organizations are getting on and trying to put, putting their spin on it and how it applies to their specific population or their focus area. But that doesn't equate into wages. And so there's several things that we're kind of hopeful that NRI is going to get behind and start publishing this next year. And we'll have to get that information directly from the states. Sorry, that was a long-winded answer.
Never apologize for being excellent and having phenomenal information. I mean, that was just like, I also love that we were like, oh, we don't know much. We don't really know. And Amy's like, I have lots of things to say and lots of great opportunities to share information and where things are going, which is really exciting. So great to know. Looking forward to the future. I also want to highlight that I think, and Jen, if there's anything happening kind of broadly in the diversity within the behavioral health workforce space that you want to highlight, definitely jump in here. But I think you're highlighting something that I think is a challenge, Amy, which is to say, we're kind of in the information gathering stage in a few different places. I'm part of the National Partnership for Behavioral Health and Tobacco Control, which is a combination of mental health organizations, public health organizations, and folks that are working specifically like American Lung in tobacco control and cessation. And one of the things that we did this year was diversity, equity, inclusion across the hiring and retention pipeline. So basically, what are your practices for identifying and recruiting diverse talent? How are you sustaining diverse talent? How are you promoting diverse talent and mentoring folks? And it was clear across the membership group that there were a lot of folks who didn't really know what was happening in their organization, although they were aware there were practices. And so I think it seems like there's some space across everything to really identify and start to capture those indicators so we can be better about engaging with diverse populations. Awesome. So I want to make sure we give space to this slide where we're talking about what NAMI is doing to support peers, and then specifically to the certified peer support credentialing process, because I think this is a little bit different than the standards. And I'd love to hear people's perspectives about what their NAMI is doing or what NAMI National is doing in both of these two questions. And absolutely second Kelly in terms of thanking our ASL interpreters for being fantastic. Related to this slide too, and I'm thinking, Amy, of the presentation at NAMICon, we saw a lot of folks who are identifying the identification of peers as part of attending Connection and then becoming Connection support group leaders, becoming trainers, kind of working through the NAMI portfolio, taking on more leadership roles, and those folks becoming part of the peer support workforce as a function of those initial connections to NAMI. So I think that NAMI's been identified as really good at engaging with folks who show promise and could really be excellent peer support folks. I would love to hear from the audience if there's anything they're aware of their NAMI doing or NAMI's doing in their community in either of these two questions. And Amy, if you want to add anything here too as well, I want to give you some space.
Yeah, I'll share some while we're waiting for some comments and maybe questions to come in. I can share. So I don't think I even shared this at the beginning. This just shows you how slow I am today. So I am a person with direct lived experience, mental health and substance use recovery, and I got certified as a peer post incarceration more than 10 years ago. And it was interesting that I got certified as a peer, but then I couldn't find a job as a peer because of my felony background. So thank goodness my state didn't have felony or background checks at the certification level, or I wouldn't have even been able to get certified. So I would have come out and said, nope, I can't even get certified. So this isn't a space that I'll ever be able to work in. And I could have left, and nobody on this call or nobody I've met in the last 7 years would have ever known that Amy Brinkley even existed. So so that's just a little plug for the SAMHSA model standards, I guess. But my point is that nobody would hire me for 2.5 years. So I had a pretty heavy corporate level manufacturing position overseeing 150 staff before I went to jail. So I have some experience in leading people, but I couldn't get a job anywhere except at a local pizza place. So nobody wanted to hire me after my felony background. So what happened for me, at least, is that NAMI, I got my support from NAMI. So I ended up I started attending the support groups, and then I became a support group facilitator. I attended peer-to-peer, and then I became a peer-to-peer trainer. And then I'm also a family member. So I went through the family member course, and then I became a family member. So I ended up developing all of my resume building skills from NAMI. Like, just those opportunities gave me resume building skills that actually looked great. So when I went to apply for a different position at another community mental health center, I ended up getting hired finally. So they had to go through, because of because of a felony background, the state, kudos to the state, because they had a waiver process in place. And I had someone go to the executive director of the community mental health center went to bat for me because Medicaid has its own screening processes on background checks. So there's additional steps that you still have to do. But there just needs to be a process for people to come back. Just make people change. Like, we need to make a process for people to come back. So all of that said, I got my support from NAMI, and I wouldn't even be working in the peer space if it hadn't been for the support that I received from NAMI, specifically as I was transitioning back into my local community.
I appreciate your transparency and your vulnerability, and appreciate that we're able to learn from your expertise. Want to highlight that Ariel's comment about being recruited to facilitate a veteran-specific peer-to-peer class. And so recognize that NAMI is a place where people can be safe, that can be supported, and that we're serving our communities as a team. And I love that. Jen, I want to make sure that if there's anything in terms of work that's occurring within the national office related to peer support or the credentialing process, if there's anything that's resonating from this slide, that you're giving some space there.
Leah, thank you. I'll tell you, Amy, I'm actually still thinking about your last comment about just the barriers that were put up for you given your background. And I will say we have done there is a lot of work that needs to be done to help to remove some of those barriers that just perpetuate a stigma and discriminate against people who have a criminal background check, a criminal background, whether that's in the context of trying to become a provider. We also see it in the housing space. We see it in eligibility for other benefits like food stamps. It is astonishing when you step back and look at the number of ways that we've established public policies that basically continue to perpetuate a situation even after someone has re-entered the community, that they still face an enormous number of barriers. So I'll just highlight that this is an issue that we are very much aware of, and it is going to be, we're pushing a boulder up a mountain, but it is an issue that is of high priority, especially when we look at our criminal justice diversion work. That being said, Leah, I appreciate you offering space for additional comments. I will flag, I hope that most people on this call are signed up to be a NAMI advocate. You can do that, go to our NAMI website, add your email address. We won't email you that often, but I promise when we do, it will be for a good reason. Part of the reason I'm pumping this additional opportunity to sign up as a NAMI advocate, later this week or early next week, we are going to be sending out an opportunity for people to help us tell the federal government to make a change related to peer support workers that we think will be significant. The Department of Labor collects data on different job categories, but right now there is no specific job category for peer support specialists. As a result, the data they collect, there's nothing specifically on peer support workers. So I think, Amy, you mentioned it earlier that when you try to look at wage data, when you have the Federal Department of Labor that collects wage data for lots of different professions in this country, there's not an opportunity for them to even collect it for peer support workers. There's a wonky opportunity coming up where basically the Department of Labor is looking at those classifications. They did not specifically ask whether peer support specialists should be added, but you know what? We're going to tell them we think that's what should happen. And we would love for people to be able to reply to that advocacy action. Basically, we'll make it as easy as possible in the template email for you to be able to raise your voice and tell the federal government, hey, this is an important part of the workforce. You need to be looking at them specifically so that we can have data and understand what the landscape is if we're ever expecting to be able to achieve the goals that we identified earlier of having, peer support workers be able to bill in all forms of health insurance and be able to bill at a level that provides a decent living wage. So please, if you haven't done it yet, I will drop the direct link in the chat yet, but would love for folks to sign up and then keep a look out on your email because it'll be coming either the end of this week or early next week. We're still figuring out the timing.
Awesome.
Thank you, Jen, for saying that. I'm so happy that you said that. And I'm sorry, Leah, to cut you off. I was just so excited that Jen shared that because I wasn't even sure that this was on our radar. And I know I saw Tim Saubers is in he's been in the group. I don't know if he's still in here, but shout out to Tim because the National Association of Peer Supporters put out a big call out too. And I know that there was proposed legislation last year that did not end up that this proposed language change through the Department of Labor ended up getting cut out of. And so to see that the Department of Labor has something that we can start providing that feedback, this is huge. So I would even encourage Tim, if he's still in the call, to share, because I know he's got some advocacy stuff out there related to this topic as well. So Tim, if you're still here, feel free to share some links in the chat for people to sign up. Sorry,
Awesome.
Leah, back to you.
No, you are perfect. Don't ever apologize for being fantastic. Want to give a shout out to Bree. Thank you so much for your story and also your acknowledgement of all the good work that NAMI does. Proud to be part of this organization, proud for the work that we do for individuals, families, and communities. Lisa had identified that she wanted to share her story. If you're still on here, Lisa, you can unmute and share.
Good morning. My name is Lisa Stridinger. I'm a peer support specialist in Washington State. And I just wanted to share in 2019, I became a peer, got my peer support license, but then was not able to get my affiliated counselor license or go into the field due to felony record that I had. One of our advocates through not NAMI, but the Washington Recovery Alliance, Lauren Davis, introduced a House bill to Washington State, and through many advocates, I just happened to come alongside. And we were able to get House Bill 1907 signed by the governor, which opened up a huge door and allowed it per person, per case for peer support to write letters to the Department of Health and everybody to be able to get our certifications. And then through that, I was able to get my affiliated counselor license, because just because I had my peer counselor license didn't mean that I could go into the behavioral health agencies. So that House bill opened up the doors for the people with the lived experience and just exploded the robust recovery epidemic here in Washington State with the peer.
Awesome. Thank you so much for sharing, Lisa. I also want to highlight Colleen is talking a little bit about the exemption process in Florida being cumbersome. And so I appreciate people sharing their stories and their perspectives and recognize that there's some room for improvement to make it easier for folks who can serve peers to be part of the conversation early. Amy, did you want to follow up on Tim's comment?
Oh, no, I just saw he put the link in the chat, and it's exactly what Den was talking about, that Department of Labor public comment space. So I would just say sign up, have your voice heard, every possible opportunity that you can weigh in on that and ask for a peer support designation within the standard occupational classification of Department of Labor. Please do it. So sign up, sign up, sign up. So Leah, I'm not sure how much more we need to cover. I know we're down to about 15 to 20 minutes here, but I was going to talk a little bit about the certified peer support credentialing process as well, because I know in our state we actually had a contract with our NAMI state affiliate to develop a youth peer certification and training curriculum. So I know that NAMIs, and we saw through the survey, we saw that NAMIs are actually in the peer support credentialing space as well. And that those were the two top, if I remember correctly, those were the two top identified spaces that the survey said we needed to be in. So I didn't know if anybody else had any thoughts on that, or if Leah, you had any other thoughts around that?
So I think you're reading my mind, which is awesome and convenient. Certainly, I think credentialing process is something that came up. Training is one space in particular where people were saying, whether it is a formal requirement or whatever those requirements are at the state level, there's an opportunity because NAMI has very high quality training. Support for peers is something that I think NAMI has just distinguished itself in and is one of the areas in which people were most aware of. Even folks that were non-NAMI affiliated really understood, and those were the two areas the non-NAMI folks really identified as being space where NAMI had distinguished itself, and that was in training and in support for peers. So I think that certainly is something that we want to highlight. I want to make sure that I'm not missing anything in the chat, because you're right, we are absolutely getting near the end of things. Interesting question. Go for it. Yeah, go for it.
No, I was going to say, while you were looking, I was just going to chat about something that I put in the chat earlier. Okay. So somebody in the chat had made a comment about role drift and peers being asked to do things that they weren't hired to do. And we've been having a lot of conversations about that in several different national meetings that I've been in recently. And so I put in the chat SAMHSA's SAMHSA's advisory on peer support services in crisis care. So, and I can put that in the chat again, but in the document, there's a lot of examples and call out for organizations to not allow the role drift. And it talks about it in two different ways. It talks about the peer role drift as the individual, but then peer role drift as like within the organization as well. So as a certified peer, I'm not here to be your friend. I'm not here to be your sponsor. I'm here to be your peer support provider. And then at the organizational level, I'm not here to sweep the floors. I'm not here to be the janitor. I'm not here to, take blood pressure. I'm here to be a peer support provider. So like there's two different lenses that document looks at role drift through. So if that was helpful to anybody. And then I also put in the Peer Recovery Center of Excellence has got so much resources on peer support, peer certification, just all kinds of stuff. So if you haven't seen the Peer Recovery Center of Excellence yet, please go see the Peer Recovery Center of Excellence website. And I think I put it in the chat a couple times.
And again, all of the slides will be shared with folks. And there's a lot of content on the slides that we didn't even share because we wanted to be facilitating a conversation as much as sharing knowledge. So I think we've found a pretty good sweet spot in terms of giving lots of good content, but also giving people space to share their experiences and ideas. Somebody said compassion fatigue is a real thing. And I want to highlight that supporting individuals, regardless of your role, is absolutely can be an emotional draining experience in terms of workplace. And so giving people the space for their own support, giving people the space to be supported. I'm grateful for the work that NAMI does in supporting peers as part of that work and helping communities and individuals. And so I think that's important for us to look at. That certainly talks about the employee assistance programs and how we are supporting at the employer level a healthy and resilient workforce. And so I think there's some great opportunities for us to share some of these resources. I realize we're getting closer to the end of time, and I want to make sure if there's any kind of last pieces of conversation that we really need to highlight before we call it a day. Opportunities for sharing last announcements, or if there's additional resources, we want to make sure to highlight that we actually have these things in there. Oh, and I want to highlight that NAMI is also doing some great work in the workplace mental health more writ large through our recent poll in terms of asking people's perspectives in workplace mental health and how work is affecting their mental health. And so grateful for our research expertise in addition to our programmatic work. Okay, last few questions. And I'm like, there's so much happening right now. I'm just very excited for this fabulous conversation. Question about implementing a peer support certification process in Puerto Rico. Amy, what do you think?
Well, I know that we have a representative with NASHPD. We have a representative from Puerto Rico, Juan Veloz, and I thought they had a peer certification. So I would say, I guess in response to that, maybe send me an email and I can connect you with the peer recovery lead from Puerto Rico. And if that's something that we need to like work with you guys on or provide TA around, we can connect them with the right folks. That would be my response, because I thought they did, but I could be wrong.
It seems like our answer for many things is Amy either knows or knows the people that know, which is it's a great thing to know, somebody that knows those things. Somebody asked the question about education, recognizing that there are no formal education requirements, but that we have some training opportunities. Do we see any content that is missing or training constructs that haven't been addressed by some of the training that's being promoted? Is there anything in terms of the nature of work where we'd like to see people getting more preparation or content areas that we think would be important to emphasize? Amy, love to hear if you think that there are some elements of an effective training program that could help somebody be successful in the peer support space.
That was a very long question, and I'm not sure I got it all, but towards the end, I just want to respond to that part. So I would go back to what you said, Leah, earlier, is that it very much depends on where you're working. So SAMHSA already has their defined established core competencies for peer support workers, and that's what most states use to develop their actual peer trainings. And then there's a test to show that you've met those competencies. But then I think the endorsements and the additional trainings are usually based off of where you're working. For example, if you're going to be working in crisis services, there's additional trainings being developed by states to work in those spaces. And then there's some that a lot of peers take on their own just to, grow, and mental health first aid and QPR. And, there's other things that peers can tag into that actually tie back to their continuing education unit requirements for recertification too. But that was a pretty big question.
It was a big question, I realize. And I want to get really specific as a follow-up to that. We've seen a few questions about the intentional peer support core training. Do you see any space to recommend or to integrate as part of guidance or for NAMI to help support this?
That I'm just going to be very transparent with you. That's
Absolutely.
One of my weakest areas is IPS. So I would venture to say yes, and I would love to see what that looks like. And I think that's, at first I was like, oh no, why are they asking me about that? I know nothing. And then I was like, oh yes, they're asking me about this. Now we can learn. So what can happen is we can actually take that back to the NAMI peer credentialing work group and say, hey guys, this was a question posed. What do we think? Let's dive in. Let's take a look at it. Let's see what's here and see if there's anything here that we can unpack.
I love that as a next step because number one, I love the paradigm of I don't know everything, so I'm going to learn with my colleagues. It's just a fabulous way to approach a question like that. And I think that is a really interesting space for that work group to really dive into something and think about what is there a space for NAMI to offer a policy statement or some other element related to that. So if there's anything that I can do to be helpful in that process, I'm happy to. Okay, so I think we're at the point where we've answered all the questions that we can effectively answer and have had a really robust and exciting conversation. As Kelly mentioned, please do the evaluation that you will get as part of that. I want to give Jen a chance if there's anything you want to say, final words.
Do the evaluation and then sign up to be a NAMI advocate. Thank you all.
Amy, last thoughts before we conclude?
No, thank you guys so much. And I look forward to seeing how we can move forward on NAMI helping support the peer support space. So, and I've already emailed about the IPS training. So thank you for putting your email in the chat, Stephen.
Awesome. Kelly or Bailey, anything we need to do to conclude?
Thank you so much for this wonderful presentation. This does conclude today's session, and you may now disconnect.